Hey everyone, Emily Leonard here. So for those of you that do not know, this is not a normal YouTube video for me. I am in school to be a drug and alcohol counselor, and this is one of my final projects that I have to do for this specific class. It's about group counseling, and I had to pick a theory to write a paper about and to do a presentation on. So this is that presentation. It's on Adlerian therapy in a group setting. So if you're interested in that, definitely stick around and find out what it's all about. And be sure to hit that subscribe button while you're here. And so let's get started. Adlerians focus on conscious aspects, on goals and motives, and deal with the present rather than exploring the past. In Adlerian therapy, the client is looking at the here, the now, and are figuring out why they currently act the way that they do, how it can help them change for better, and how to apply the change to their current lifestyle and their circumstances. Adlerian therapy is evidence-based in its approach and can be applied successfully in the treatment of any kind of psychological disorder or mental illness. Adlerian therapy may be used in conjunction with other therapeutic approaches such as play therapy, art therapy, cultural sensitivity counseling, and it's best used with individuals. This type of therapy is not for people who expect quick results, and it does not cater to those who only want to be in therapy for a brief time, but I will talk about that in a minute. There are different aspects to the therapy that can be brief. Adlerian therapy takes effort, dedication, and commitment, which is pretty much any type of therapy you're going to go to. While it can help the individual transform into a healthy and happy adult, it does not happen overnight, as most therapies don't. But according to our book, as an application, brief therapy is an approach that is concise, deliberate, direct, effective, efficient, focused, planned, purposeful, and time limited. So the point of this type of brief therapy is to get as many people as they can and affect as many people as they can in a short amount of time. And it's done by having a rapid establishment of strong therapeutic alliance, clear problem focus and goal alignment, rapid assessment, emphasis on active and direct therapeutic interventions, a focus on strengths and abilities of their clients, an optimistic view of change, a focus on both the present and the future, and an emphasis on tailoring treatment to unique needs of clients in the most time-efficient manner possible. So it's basically doing all this as fast as you can, but still being effective and hitting all the points of your clients and what they're struggling with. In my paper, I focused on the 8 key concepts of Adlerian therapy and Alfred Adler's system, which included holism, which is the focus. The focus is on understanding the whole person within their socially embedded context of family, school, and work. Individuals are always more than the sum of their parts. Second was teleology, which says that humans live by goals and purposes. Adlerians relate the past to the present only to indicate the continuity in the maladaptive style of living. So they're not just pulling things out of your past to try to affect you. They're trying to find out how they can relate it to what's happening today and how they can move you forward. It's not ever to show a casual connection. They're not going to be like, oh, well, this happened, so this is why this is happening, but it might not be. The third is the concept of phenomenology, which is the study of structures of consciousness as experienced from the first person point of view. In this theory, objective reality is less important than how we interpret reality and the meanings we attach to what we experience. Fourth is the concept of societological approach, where Adler believed that what we are born with is not as crucial as the use we make of our natural endowments. The fifth concept is that of the community feeling and social interest. Community feeling embodies the feeling of being connected to all of humanity, past, present, and future, and to being involved in making the world a better place. Social interest refers to the individual's positive attitude toward the engagement with other people in the world and the individual's capacity to cooperate and contribute. The sixth concept is that of inferiority and superiority. Adler believed that some people become mired in their inferiority. He felt that we are all born with a sense of inferiority, which is often added to by various psychological inferiorities later. Most children manage these inferiorities by dreaming of becoming an adult. We dream of it and then we get here and it's not always that great. It's a lot of responsibility. And they either master what they're bad at or they compensate by becoming especially adept at something else. However, not all children dealing with a strong sense of inferiority become shy and timid, and you would know these people as bullies. It's also called a superiority complex, which is a dramatic act of overcompensation on the child's part. These people are your playground bully. They chase away their own sense of inferiority by making others feel smaller and weaker. And they may be drawn to criminal activities and become greedy when, they might need more attention than other people. The seventh concept is that of the role of the family. Adlerians place a great emphasis on family process, which plays a significant role in the development of personality during childhood. And lastly, Adlerian therapy emphasizes style of life, which is our basic concept of ourself in relation to the world. Our personal orientation towards social living is expressed in a pattern that characterizes our existence. The Adlerian theory is effective in group settings because each of the concepts surrounds the theory are community-based, and a group setting can equate to its own community. This also centers itself around feelings of belonging, and a group setting is a great place to test the behaviors before applying the concepts to real life and somewhere outside of the group. During the groups, the members may come to see that many of their problems are interpersonal in nature and that their behavior does have social meaning and that their goals can be best understood in the framework of social purposes. There were several interventions that I focused on, and some of them included the hypothesis interpretation, which is the purpose of using a hypothesis interpretation is to convey to the client that more than one explanation for behavior exists and that the counselor just wants to check his or her own hunches to see if they're on mark with them. A second intervention includes the push button technique, which I thought was kind of unique. It seeks to interrupt a depression and helps clients become aware of their role in maintaining or even creating their unpleasant feelings. So I kind of like this type of therapy because it allows the therapist to put the responsibility on the client. And it kind of comes off as like victim shaming, but it's really not. It's making you aware of what you're doing in your world and how it's affecting your life. And it makes you take responsibility for what you're doing. Well, because while depression is a medical problem, it's also something that can be helped with interventions like exercising, getting outside more, taking your medication on time. Like all these different aspects can be drawn into how you can help yourself. A third intervention is catching oneself, which includes encouraging clients to recognize behaviors contributing to their problems on their own. Clients may initially catch themselves too late and fall into old patterns of behavior, but with practice, clients can learn to anticipate the situation, recognize when their thoughts are becoming self-defeating, and take steps to modify their thinking and behavior. So it's basically saying anybody can catch themselves. You might catch yourself doing something and you're like, maybe you're on a diet and you catch yourself eating something that you shouldn't, or grabbing something that you shouldn't be grabbing for in your diet. And you can basically stop yourself and say, hey, you know, I'm not supposed to be doing this. Let me try something else. A third intervention includes spitting in the soup, which sounds kind of silly, but it is a process of interpreting goals in order to facilitate change and to assist the client in recognizing the possible behavior intentions they may previously have been aware of that are not consistent with your goals. The last intervention includes the concept of acting as if. Now, we've all heard this before. Act as if you are famous. And I actually just saw an article about this, about social media influencers. And this person was acting as if, but they didn't have the money of a social media influencer. So it kind of makes you just distrust Instagram a lot. And it consists of the professional counselor asking clients to begin acting as if they were already the person they would like to be. They say dress for the job that you want when you go to an interview. It's a perfect example. The purpose of the procedure is to bypass potential resistance to change by neutralizing some of the perceived risks. The other side of this intervention is reflecting as if, which expands the technique by having the clinician ask the client to take a reflective step back prior to stepping forward. And the process encourages clients to reflect on how they would be different if they were acting as if they were who they desired to be. By using reflective questions, counselors can help clients, and they can construct perceptual alternatives and consider alternative behaviors toward which will help them start to move forward. All of these interventions can be applied to group counseling because each intervention or strategy aims to increase positive emotion, engagement, and meaning by emphasizing individual strengths. The purpose is to teach participants specific skills and identify character strengths and use them effectively with an overarching goal of reducing problems in behavior, emotion, and cognition. There is a diversity perspective, and it mostly comes from her book. Adlerian theory is great for culturally diverse clients because it emphasizes an understanding of the individual within a social context. While it refers to the individual, the emphasis is on the person in the environment, and culture can help define clients in a manner that is respectful of individual and cultural diversity. Therapists can learn a lot from a lifestyle assessment, which is a way to learn about the world and the client. A clinician could also ask clients to describe their early family situations, to learn about cultural values, traditions, parenting, styles, family dynamics, social conventions, and religious backgrounds. My assessment of this type of therapy is a positive one. I like that it's focused on the present and not the past, like that of Freud. I also like that it makes the client take responsibility for the current situation, letting what has happened stay in the past, and that they focus on the present and the future. I like that all of the interventions and strategies make sense and that the theory itself is congruent with many other current psychological schools, such as Gestalt therapy, existential therapy, social learning theory, reality therapy, rational emotive behavior therapy, cognitive behavior therapy, solution-focused brief therapy, acceptance and commitment therapy, positive therapy, and the person-centered approach. These are all based on a similar concept of the person as a purposive and self-determining, and as always striving for growth, value, and meaning in the world. Alright guys, if you like this video, be sure to give it a big thumbs up. Don't forget to hit that subscribe button over there, and I will see you guys in the next one. Bye.